A1 Healthcare presents COVID-19. Different types of tests explained. You wake up one morning with a fever. Is it COVID or something else? The only way to be sure is to get tested. But what kind of test do you get? Here are 3 types of diagnostic COVID tests that can tell you if you are currently a victim of COVID-19. Number 1. Antigen tests. These are typically used as rapid tests. If you get a positive result on a rapid test, you can feel pretty confident you have COVID. But if you have symptoms and test negative, you may need to confirm your negative status with PCR test to be sure. Antigen tests sometimes result in false negatives. Samples are taken either by nasal or nasopharyngeal swab and results are given in 15 to 30 minutes. The Centers for Disease Control and Prevention, CDC, has advised people who show COVID-19 symptoms but test negative with a rapid antigen test to get a PCR test to confirm the results. Positive antigen tests are considered much more accurate, but they still can produce false positives. The concern, Tran said, is false positives could be caused by the presence of other viruses, improper collection techniques, or other substances produced by the body during infection interfering with the results. However, he said, antigen testing technology continues to improve. Number 2. Molecular PCR tests. This is another area where there is some confusion. Not all molecular tests use the polymerase chain reaction, PCR, but PCR serves as the mainstay of COVID-19 diagnostic testing. PCR has also become a common shorthand in many media reports. Molecular tests detect genetic material, the RNA, of the coronavirus and are sensitive enough to need only a very tiny amount of it. A nasopharyngeal, the part of the throat behind the nose, nasal, throat, or saliva test is administered to detect the virus. Results aren't immediate and can take anywhere from 45 minutes to 1 week. Number 3. Antibody tests. These are not considered diagnostic tests that can determine if someone has an active COVID-19 infection. They use blood samples to look for antibodies produced by a person's immune system to help fight off COVID-19. These can detect if someone had a past COVID-19 infection but not if they still are positive for the virus. Tran said antibody tests may have more value once an effective vaccine becomes available. Don't forget to like, share and subscribe A1 Healthcare YouTube channel.